Jazzcast Pros.
Welcome to the Healthy Illness Podcast. I am your host, Kelly Marie. This is the podcast where you learn to build healthier relationships while living with mental health conditions. I am just a person out here with mental health conditions using my life experience, my education, my years of therapy, and using the tools to help you to be able to live the healthy life you deserve. By the end of our time together today, you will know the difference between a doula and a midwife. And if that is something that you would like to dive deeper into, either as a patient or a practitioner. Big shout out to Jazzy T from Jazzcast Pros, our podcasting network. She is incredible, and I will continue to sing her praises as long as y'all are listening, long after you are listening. So, Jazz, thank you for all that you do and for keeping me in line and accountable. You know, it's so important when we talk about accountability and when we look at this area of maternal health and accountability, we see that maternal health outcomes are not the same for all folks. And in the United States, Black women have worse health outcomes than their white counterparts. And so what does that mean? That means that Black women are dying at higher rates. Their newborns are dying at higher rates. They have worse health outcomes, meaning the return to life after birth is different than it is for white women of the same socioeconomic background, same education level. And there are reasons for that. Health outcomes are different for different groups of people. And as long as we pretend like everyone is treated the same, no one will be treated the same. When we consider in the lifespan of humanity how people have been giving birth, we haven't been giving birth in hospitals, right? This is a new phenomenon. We have not had licensed medical professionals helping women and their families, helping people have healthy births, have healthy postpartum care. Like that's all new when we look at how medicine and health is generally practiced across humanity. And so there was a decrease when hospitals, as we know them today, hospitals kind of came on the scene and they began to make a change in basic hygiene. And we saw an increase in life outcomes when doctors and nurses and, clinicians and stuff were washing their hands and using soap and, all that kind of stuff. Like we saw some positive changes. This upfront, listen, is not a knock towards medical professionals. This is not, I'm not about to tear apart the, healthcare system. But what I am going to do in this episode is build up the work of doulas and the work of midwives. I am a doula. So I wanted to just spend some time talking about what a birth doula is. And there are different types of doulas, but what a birth doula is and also what a midwife is. And that way you kind of have a baseline going into this conversation about what these two roles are in the continuum of care for birthing people. Like I said, I'm a doula, and I said that I would talk about my experience, and I'm going to do that. I want to really share how I got to this place with you. And I think it's important to know what drives a person. And for me, it was a familial connection and being a part of the birth of my niece. And when I listen to other people tell their stories, I'm like, oh, that's really cool. That's super sweet. My experience was a little different. Everyone's experience is different, right? Like we're all different people. So everyone, even if it's the same role, same type of people, everyone is, has the same background. Like regardless, the experience is going to be different because we are all different people. So let me just put that out there. For me, my experience with assisting my sister-in-law during her birth I want to just share my piece of it. And she's aware that we're having this conversation. So I'm not sharing anything that she is not aware that I'm sharing. But I do believe that people have their own story. And so I want to uplift her and her journey and her story and leave that story and journey with her. And so for me, being in the room with her and my brother, I wanted to make sure that she knew she was supported, that she knew this baby was coming out regardless, right? Like it doesn't quite matter how we feel about the situation in the moment. The situation will end, right? Like the baby is going to come out. And so how can I help her? How can I help him? And even, the nurses and medical staff, how can I help be the best person for her in that space? And I didn't know what a doula was. And while we were going through contractions and breathing, the nurse asked if I was a doula. And this was about 12 years ago. I did not know what a doula was. And I told her that, no, I'm not. I don't know what a doula is. And she was like, you should look into it. This is what a doula does, and you're doing great at it. And so I kind of put that in the back of my mind, like, okay, this is something I can do. But I did not think, while that was her recommendation, I did not think I was qualified to become a doula because I had epidurals for all three of my children. I did not breastfeed my children. And so I felt a disconnect in my birthing experience by way of being able to help someone in theirs. And so I learned what a doula was really recently, because the scope of doula services in midwifery has changed over the years. In Buffalo and New York State, doula services are paid by Medicaid. It's a new payment system here in the state, relatively new. And so there's been a big push to recruit more doulas for training, more people to become doulas. And I learned about the process in that space. So I became a doula, went through all the trainings, and always in a place of learning, right? There's never a time that we stop. There never should be a time where we stop learning. And so I just thought it would be a great opportunity as we are shifting back to more holistic care. There's a greater call for doulas as parental health outcomes and maternal health outcomes are on the decline, as states are beginning to change their laws and policies around childbirth and around women's health and around access to healthcare. It's so important to be able to know what resources are in your area. It is important to be able to shift into that space, if that is a space you feel called to lead in and to be in, and to be aware of what's happening. And so with that kind of mindset and understanding, I know that there is a lot of confusion around what a doula is, what a midwife is, what they do, how they work, and what is their purpose and goal in the space of childbirth. And so let me just start with what a midwife is. Then we'll go into what a doula is, because that's the place that I'm in. And so a midwife is a person who provides clinical care. They are well-versed in pregnancies, in labor and delivery, from a clinical perspective. They can diagnose, they are there to support, they are there to provide all of the clinical supports. They often have an assistant with them. And so they take the place of a doctor in a like birthing center or home birth. They are the medical expert in that birthing space. Midwives have received medical training. They specialize generally in OBGYN practices and have advanced degrees and certifications and things like that. A lot of midwives are nurses. I have found just in meeting people and reading up on the space, and they use that medical background as well to be able to work in midwifery space. They are directly involved in the care of the patient. They will be the ones to make medical decisions. Like the midwife is the medical provider in this kind of situation. A doula, on the other hand, is a person who provides non-clinical support depending upon when you bring a doula into your pregnancy experience, they help prepare you for pregnancy, or they can help prepare you for pregnancy, but they help prepare you for labor and delivery, and generally work to provide you with the experience that you desire. And so one of the things that we do upfront in the very beginning is develop a birth plan. And we'll walk you through what that looks like, what your options are. And options are going to be different depending upon where you live. And so in New York State, we have different services that, depending upon your insurance, that's covered by insurance. And so we will walk through the birth plan. What do you want it to look like? Do you want to be medicated, not medicated? Do you want to be in the hospital? Do you want to be in a birthing center? What experience do you want to have? Do you plan to be medicated? Will you have a C-section? Do you need to have a C-section? Is it something that is recommended, but you want to do some more research to see if that is actually something that you need to have? The doula does not make medical decisions, does not make clinical decisions, but we are, in essence, your birth coach. We get you prepped, we get you ready, and we are there right beside you during your birthing experience. One of the takeaways that I received in my training, and I'm trained by Nakia Lawson, so I'm trained by Nakia, and we, in the training class, we were talking about giving voice and the role of the doula. And one of the things that she said that really stuck with me is we cannot become what medical professionals are. And so oftentimes we will find, and this is true, you'll see this as you read about just not even maternal health outcomes, just health outcomes in general, that doctors make decisions for patients. They are dismissive of patients, not all, but we're talking about the cases in which this happens. And we'll talk around and above a patient's understanding and kind of push their agenda. And so we as doulas are there to uplift the voice of the client, of the patient. And so they are not patients to us. They are our clients. We are not medical professionals, right? And so it is my place to ensure that the client has their wishes met. And so it's important for me to know what they expect, they being the client, what they want out of their birthing experience, so that in the heat of the moment, when those contractions are coming or there's a decision to be made, my client has all of the knowledge they need to be able to make that decision. And I am there to coach them through that decision. And so if I see something that's happening, it's not for me to make a medical call. It's for me to talk to my client and walk them through that moment. What did we discuss about, for example, an epidural, right? The contractions are coming. You said you did not want an epidural, or you wanted to use comfort measures. You want to try some comfort measures first before we go into medication for pain and discomfort, right? It is not my call to make, but it is my call to know what my client wants. And it's my duty, I'll say, to know what my client wants. It's my duty to remind my client of what they want and to dive deeper into all of the things that we've done during the time of their pregnancy. So comfort measures. We practice comfort measures. In what ways can we move the body? Can we use acupressure to be able to relieve pain if the client has done all of the things that they were supposed to during the pregnancy, like stretching and drinking water and doing breathing exercises and things like that when we're not together? We do those things when we're together, but it's important for the client to do those things when we're not together so that they're prepared for the delivery that they want. We don't know what that's going to be, right? And things happen in the moment. However, we prepare for the experience that the client wants. So that big takeaway is we prepare not only the client, but their team. Like, who is your labor and delivery team? Like, who's your partner? Who's going to be there in the room with you? What relatives do you want at the hospital? Who's at the house getting things ready? Who's going to support you when you get home, right? And so whether you have a partner or whether your family is supporting you, like all of those things are things that we discuss so that when labor and delivery comes, because it's coming, everyone is prepared. Everyone knows their role. Everyone knows what to expect. Everyone knows what plan B is if plan A doesn't work, right? We are the coach. We speak life, right? We ensure that all of the questions that a client may have, they get to ask their medical professional. We don't do the speaking. We don't become, and that was, kind of the point that I was alluding to earlier. We don't become the voice that is dismissive of the client. We uplift the client's voice. And so it's not for me to say, my client said they wanted A, B, C, and D. It's for me to turn to my client and say, listen, when we discussed your birth plan, these are the things that you wanted. Is this how you want to move forward? Do you want to talk to the nurse? Do you want to talk to the doctor? Can I bring someone in for you to be able to discuss why they're recommending a specific treatment, et cetera? It's not for me to speak on behalf of the client. Otherwise, I become just like the people that did not listen to her voice, right? And so being the coach means knowing my role and staying in my place and in my lane to not distract from the medical providers, to not take away from what they're doing, but to enhance my client's experience so that they have the birth experience that they want. And so when folks are thinking about, whether or not to have a doula, depending upon where you live, your medical insurance may cover doula services. You can always become a private pay client. Doulas generally have a payment plan and, you can work with them to figure out, your payment schedule and all those good things. Depending upon your medical situation and how much prep you want and desire, the earlier you bring a doula on, the better. And let me kind of take a step back. So first trimester, there's not much we can do, right? We can begin, the process. We can work out the birth plan. Like having a birth plan is something that you can do now, regardless of your pregnancy status, right? Like you may be thinking about having children. So you can begin to look at what a birth plan looks like. You can begin to tour birthing centers and labor and delivery units and things like that. So those are things that can be done at any point before or during your pregnancy. But bringing a doula in the middle of your second trimester, beginning of your third trimester is great, depending upon, again, who you are, what your needs are. Is this your first birthing experience? Is this your 10th birthing experience? It's going to be different for each person. It's also going to be different for each doula. So we provide a service, but we are all different in the way we provide that service. My recommendation would be to ask questions of doulas if you're interested in having a doula in your birthing experience. I think that would be a great topic of conversation. So why don't we do that next? Let's talk about the questions. What questions should you be asking someone who you are interviewing to become your doula? Yes, you should be interviewing your midwife if you want that experience, your doula if you want that experience. Yes, one should be going to labor and delivery units to tour and see what is available. Go to birthing centers and tour birthing centers and talk to people and see what's available so that, again, you can have the experience you want. It's never too early. You can call your birthing centers in your area. You can call labor and delivery units in your area, start attending childbirth education classes. And so what I'm going to do for you, and I'm going to upload this on the website, I want you to go to frontseatlife.com if you're interested in having a birth plan. I would like to offer you that service. So let me see. 25 folks, I will offer you a free birth plan session with me over at frontseatlife.com. We'll set up a virtual appointment and work through your birth plan. I like that. Let's do that. And we can talk about questions on our next time together. You now know the difference between a doula and a midwife, and you are going to learn about questions you should ask your doula if you're interested in having a doula, a birth doula, or even a postpartum doula. We'll talk about that too as a part of your birthing team. Head over to Front Seat Life. Fill out the form if you are interested in a childbirth plan session with me. I will offer that to you, free to you. There's always a charge, right? Things will cost time or money. And so I don't want you to think of this as a free experience. It's not. It's going to cost you some time. You are going to have to begin to think through some decisions that you'll need to make as it comes to developing this birth plan. So I am going to offer that to you. I am offering that to you, a free birth plan with me, Kelly Marie, over at frontseatlife.com. Enter your information. I personally will reach out to you and we will develop your birth plan together. So until the next time, where we are going to talk about questions you should be asking your doula that you're interviewing. Let me know if you have questions. Like, what would you like to know about the doula experience, about the birthing experience that I can assist you with? frontseatlife.com, frontseatlife@gmail.com. Feel free to email at the Front Seat Life across all the platforms. I'm out there somewhere. And like, subscribe, and share. Send this to someone that is in the process of baking a baby or interested in childbirth and is looking at their options and trying to figure out what their next steps are as far as going down this journey of childbirth. Until next time, I encourage you to be the light. I am your non-clinical doula provider, Kelly Marie, and I look forward to hearing from you. All right, until the next time, be the light.